Good afternoon. My name is Joseph. I'm here with Bertie and Megan. We're all students of Dr. McClendon's this month, and we'll be presenting on the non-pharmacologic therapy options for pain management. As for our background, pain is one of the most common reasons any adult will seek any type of care or medical care. Pain is a component of many chronic conditions or disease states that adults experience. In fact, about 1/5 or 20.4% of adults have had chronic pain in the US, and 8% had high impact or chronic pain. Chronic pain is pain on most days or every day over at least 6 months. In fact, I myself am dealing with an injury that precipitates chronic pain. I've had an ankle injury in my left ankle for about 7 years, and it's been bothering me for quite a while. So it just goes to show that chronic pain is not only limited to the geriatric population, but can be seen and experienced in many different adult populations as well. High impact chronic pain is pain that limits life or work activities on most days or every day for at least 6 months. And in fact, chronic pain costs the nation up to about $635 billion each year in medical treatment and an overall loss of productivity.
There are 3 different tools usually used to assess pain: Socrates, OPQRSTU, and PEG tools. The Socrates tools actually assess the size, the beginning of the pain, the radiation, the time, the severity, the exacerbation or relieving factor, and the time of the cause. It also assesses the association, because there are some pain who are linked to a nerve irritation, some are linked to an inflammation, and other type of pain are linked to nothing at all. They don't have any origin. The difference between the OPQRSTU and the Socrates assessment is that while assessing all the other compartments previously listed in the Socrates tools, the OPQRS tools also assess how our daily activity are usually impacted by the pain. The last tool mostly used is actually the PEG tool, and this tool was derived from brief pain inventory adopted in the CDC guideline, with a cube tool that used to evaluate the pain, with 0 actually being a sensation of no pain and 10 being a sensation of a highest level of pain. This is a pain rating scale which is derived from the VA, and you can see that we have a level of 0, meaning we don't have the patient does not feel any pain, and a level of 10, meaning that a patient has an intense pain. Also, the physician can read the pain level, can try to have an estimation of the pain level of the patient just by looking at his face. Somebody at a pain level of 0 is kind of happy, but when you look at somebody at a pain level of 10, you can actually feel it and see it on his face.
Now we're going to talk about the different treatment options. So we'll hit on the options, which technically are pharmacologic treatment options, but we did want to include those because they are over the counter and not prescription. We'll also talk about hot and cold compresses, different therapeutic options like acupuncture, transcutaneous electrical nerve stimulation, low impact physical activity and weight loss, and then there are several types of therapy that can be used as well, and rest, which as we all know, chronic pain is more of a holistic, we need more of a holistic approach when treating it. It's not just targeting the pain, but also a person's mood and their functional status as well. So moving into over-the-counter options, we'll start with our oral agents. So the 2 most common that we'll see over-the-counter are Tylenol and then our NSAIDs, or our non-steroidal anti-inflammatory drugs, most commonly Motrin. So I won't go into the mechanism of action of these. I just wanted to include them for completeness sake, but I did want to include some big counseling points. So Tylenol It's really great for fever. It's great for crying, but it doesn't have any anti-inflammatory properties. So when we think of patients with arthritis or other types of inflammatory pain, we'd really want to consider more of an NSAID like Motrin. As far as dosing goes, typically patients are on 650 milligrams to 1,000 milligrams up to 4 times daily, but we do try to cap the dose at 3 grams daily, and this is because Tylenol can be very damaging to the liver, so we try to cap it at 3 grams just to make sure that our patients aren't using too much and damaging their liver in the process. And as I mentioned, Motrin is our other most common agent over the counter, and that's typically in doses of 200 to 400 milligrams up to 4 times daily, and our max over-the-counter dose is 1,200 milligrams. And with our NSAIDs, it's really important to be cautious in our elderly patients and patients with kidney failure. NSAIDs can be very damaging to the kidneys, so if a patient already has kidney failure, then that can certainly cause more issues. And then also we want to be cautious in patients at risk for bleeding, and typically our elderly patients can have a GI bleed that's precipitated from NSAID use and inappropriate NSAID use. So it's just very important that we're cautious with using these and following the guidelines and recommended doses in our patients. Now moving into our topical agents, this is not a complete list, but just wanted to give some options. So we have capsaicin cream. This has to be applied 3 to 4 times a day, but it is important to counsel our patients that it can take up to a month to work. So a lot of patients will stop it way before the 1 month mark because they're not noticing a whole lot of difference in pain management, but it really can take up to a month to work. And then another really important counseling point is that it is made out of peppers. So it's really, really, really important that we counsel our patients to wash their hands thoroughly after they use this, because if they get it on their hands and apply it where they need to and they don't wash their hands, and then if they touch their face or their eyes, they can cause burns that can be very painful and uncomfortable. Some of our other options are counter irritants like Bengay. These typically contain a salicylate and menthol and camphor, which just cause cooling and pain relief together. And this is also applied 3 to 4 times a day, but it's only really for short-term relief. So our patients aren't going to get a whole lot of benefit out of this, although it is a really great option in the short term. And then our last topical that just recently became an over-the-counter medication, it used to be only prescription, is Voltaren gel or diclofenac. And this is applied topically 4 times daily. And it does contain an NSAID. So we do want to think about our patients, as I mentioned on the previous slide, that may have kidney disease or maybe at risk. For our patients who are at risk taking the oral NSAIDs like Motrin, we just want to be careful when using this. It's not really absorbed much systemically, so we don't see a whole lot of side effects, but there is a potential if it's overused to cause some of those side effects. And then our last option are topical patches like lidocaine. That's our most common. And these are typically applied topically to the site of pain for a maximum of 12 hours. So patients can apply up to 3 patches for 12 hours. And then it's really recommended that they take 12 hours off just to minimize systemic absorption of the lidocaine. Again, there are minimal systemic effects. So our most common adverse reaction we see is skin irritation with these.
Next, we have our non-pharmacologic treatment options. First, starting with heat. Heat helps to decrease pain, specifically muscle pain and stiffness. You want to apply heat to the affected area for about 15 to 20 minutes at a time. And then following heat, we also have ice. Now for heat, I mentioned we used heat for muscle pain and stiffness. For ice, we're going to use primarily for acute pain, inflammation and swelling. Like if you sprain your ankle, you're going to want to use ice. Ice helps to decrease pain and inflammation, and it also prevents tissue damage. The caveat with ice is that you don't want to apply ice for too long to the affected area. So what we want to do is apply ice for 10 to 15 minutes, either crushed ice in a bag or maybe like an ice pack. And you want to do that on and off, like I mentioned, for 10 to 15 minutes. Next, we have massage therapy, which is used to help loosen the affected area or the area in pain. And there are certain types of foods that can help to decrease inflammation. For example, green leafy vegetables, tomatoes, fatty fish like sardines and salmon. almonds and nuts as well, and also different types of fruits like strawberries and oranges. Those can all help to decrease inflammation. Next, we have dry needling, which is also known as myofascial trigger point dry needling. It's used to ease muscular pain by using a thin monofilament needle underneath the skin to help treat muscular trigger points. It's very, very similar to acupuncture. And besides that treatment option, we also have an inversion table, which is used to stretch the spine and release tension in the back. It helps to relieve back pain. Here we have low impact physical activity, which includes weight loss. A 5% weight loss has been heavily associated with a significant pain reduction in patients suffering from long-term chronic pain. We also have different types of low impact physical activity options like Tai Chi, which is a form of Chinese martial art used to help patients relax, and it has health benefits. And as well as those health benefits also include meditation, which comes with Tai Chi. You also have water aerobics and yoga, which are two other low impact physical activity options that can be used to help lower chronic pain. Finally, we have the different types of therapy that can be used to reduce chronic pain, starting with osteopathic manipulative therapy, which is a set of hands-on techniques used by osteopathic doctors or physicians used to diagnose and treat different types of illnesses that are precipitating the chronic pain. You also have physical therapy, which is used in patients that have different types of injuries to help increase the level of proprioception they're having in their joints so that they're able to move in an easier and more functional way so they can get back to those daily activities that they've been missing out on due to their injury. Next, we have cognitive or behavioral therapy. This is kind of a psychological treatment, which involves music and art therapy and pet therapy, primarily used to treat patients with depression, patients suffering from different types of anxiety disorders, even alcohol and drug abuse disorders. This type of therapy can be used to treat. And last but not least, we have chiropractic therapy, which is basically hands-on spinal manipulation that can help lower and reduce that chronic pain that a lot of patients are experiencing. Here are references, and thank you guys for your time.